Today we're discussing food justice as it pertains to individuals, the health of our societies and the world at large. First though, we're returning to the scene of a crime that has resulted in extensive physical and emotional harm and millions of deaths. One that has been so gradual that it's taken decades to be recognised for what it really is. It is what criminal justice researchers have described as food crime, the deliberate profiteering and promotion of addictive products sold as food but known to be directly harmful to individuals, communities and the wider environment. We're talking about the progressive replacement of real food by ultra-processed food products, heavily engineered, hyper-palatable products that are nutrient-poor, energy-dense and laden with refined sugar and/or industrial fat, sodium, emulsifiers, flavor enhancers, colors and other synthetic additives in highly addictive combinations. These are directly implicated in the pandemic of non-communicable diseases and inflammation, particularly obesity and cardiometabolic disease. But less attention has been paid to the neuropsychiatric effects of these products, which are also known to promote anxiety, depression, and aggression. A new Harvard study of over 30,000 Americans shows that in addition to higher risk of diabetes and hypertension, consumption of artificially sweetened foods and beverages is independently associated with depression. This is consistent with experimental data that food additives have neurobiological effects. It also adds to the increasing concerns about these products in early life, as unhealthy nutrition is a major factor in the lifelong trajectory towards physical and mental disorders. Modern dietary patterns are also directly implicated in the declining health and diversity of our intestinal microbiomes, with dysbiotic changes linked to adverse immune, metabolic and neurological effects. Today we will hear how the signs of aggression and antisocial behaviour can be experimentally transferred through the microbiome. This provides a direct connection between our unhealthy food environment and our unhealthy social environment, with vast implications for the global mental health crisis and societal breakdown. We also want to introduce the emerging concept of nutritional criminology, the subject of one of our recent research papers, underscoring the association between unhealthy food and antisocial behaviour, and the underappreciated links between health and justice. This includes the disproportionate targeting of marginalised and disadvantaged communities with addictive foods. This conversation is not separate from the wider discussions about crimes against nature in our ultra-processed world, with the escalation of industrialisation, consumerism and extractive mindsets of the Anthropocene. The official beginning of the Anthropocene has been dated to the early mid-1950s through sedimentary evidence of nuclear detonations, chemical fertilizers, and mass burning of fossil fuels. This fails to capture the loss of biodiversity, including microbial extinction, over the same period. But there is another piece of evidence from the 1950s catalogued in the Smithsonian that marks another very significant turning point for humanity. The first aluminium TV dinner tray, seemingly innocuous, yet it was amongst the first steps in the massive replacement of foods with products, damaging traditional relationships with food, including family and community dynamics, and the attrition of skills to prepare food. In the ensuing decades, big food has expanded to engulf food cultures in the global south. Now 1/3 of the global population is overweight or obese, and 62% are now in the global south. So food crimes may not be illegal, but they are immoral in terms of the harms that they cause. Over the 1970s, there was a massive expansion of engineered foods. Perhaps one of the low points was during the Nixon administration, when a high sugar breakfast cake from the makers of Twinkies became a cheap government endorsed school breakfast. Astrofood was literally a Twinkie injected with vitamins and textured soy protein cream filler. They boasted nutritional equivalency and that they had achieved what nature could not. And they were right. It is these unnatural engineered combinations that literally make these products addictive, and we'll hear more about this from our speakers in a moment. This conversation also merges with broader discussions about the commercial determinants of health in the Anthropocene. While the food industry is just one sector prioritizing profits over people and places, it is one of the most pervasive by so comprehensively insinuating itself into trusted institutions. Because in addition to engineering food and consumer behavior, they engineer academic discourse, co-opt research, and apply undue influence on guidelines and policy, often through front groups posing as social advocates. So as we look to solutions, it's vital to bring the focus back to providing real food for a real future. Food is the source of our life and vitality, literally. It's also part of our communal and cultural identity. As always, this brings us back to the universal theme that calls to address underlying value systems and worldviews to solve our global challenges with a much needed cultural and spiritual transformation for planetary health. That path depends on a deeper conscious relationship with nature and a sense of connection to all things. A meaningful relationship with food is an important way of rebuilding that awareness for personal and collective well-being. And that begins by shining a light on these issues. So now I would like to introduce our headline panelist, Matthew Robinson, a criminologist and professor at Appalachian State University in North Carolina. Author of over 20 books, his most recent on food crime is the focus of his talk today. He will speak for about 8 to 10 minutes, followed by our remaining panelists who will each speak for 5 minutes. I don't want to detract from their time by reading their bios, so I urge you to read more about them at the link in the chat. So over to you, Matthew. Thanks.